Hi, I'm Dr. Kirmani. Welcome to my channel, Patient Knowledge. For those of you who are new to my channel, I would like to mention that this channel is aimed at creating awareness about health conditions. And every weekend I come with videos related to common diseases. Each video gives a detailed description about the specific health condition. And today I will be talking about a condition that affects our heartbeat, called atrial fibrillation. So let's get started and find out more about this. In this video, I will be giving you an overview on atrial fibrillation, tell you about some of the symptoms, causes, risk factors of atrial fibrillation. We'll talk about the diagnosis and how to treat it, and we'll also give a description about how to prevent it, and towards the end of the video, we'll give you some red flags. So stay till the end. Now for a better understanding, let's have a look at the structure of the heart and how does a heart function normally. The heart is a vital organ and its main function is to pump blood to the entire body. It receives impure blood and sends it to the lungs to purify it, and then it pumps the blood back into the body. So it's a major function performed by the heart, and it happens at a regular rate and rhythm. Heart function involves the contraction of two chambers, the smaller atrium, which connects to the larger ventricle. Now here's the structure of the heart. It has got four chambers, the right atrium and the left atrium. These are the smaller chambers of the heart located at the upper part of the heart. They open into the larger chambers of the heart called the right and the left ventricle. Now the heart's rhythm is maintained by a heart's electrical conduction system, which runs from the atrium to the ventricle with the firing beginning in the atrium. This is the normal functioning of the heart. Now let's have a look at what happens in atrial fibrillation. Well, atrial fibrillation is a condition where there is a specific irregular rhythm of the heartbeat. The term fibrillation means an uncoordinated, quivering movement of the muscle fibers. In atrial fibrillation, the atrium beats too fast and the ventricle cannot keep pace and beats at a slower and more irregular rate than the atrium. The heart still pumps out blood, usually faster but not as efficient as normal. What are the symptoms? Often there are no symptoms. The most common complaint is palpitations or racing of the heart. The person who is affected most likely describes it as a rapid and irregular heartbeat. The other symptoms include weakness, chest pain, dizziness, or faintness. Now here's a list of causes of atrial fibrillation. About 15% of cases are called lone fibrillators because no obvious cause can be found. The main causes are those which affect the heart and a gland called thyroid gland. They are coronary artery disease, with or without a previous heart attack, an overactive thyroid or thyrotoxicosis, where there is the thyroid gland that is overactive, or called as a condition called as hyperthyroidism, hypertension or high blood pressure, rheumatic heart disease, especially mitral stenosis. Now these are scientific terms which basically means this is a condition that affects the heart muscles. And the last is the cardiomyopathy, including excess alcohol. Cardio means heart and myopathy refers to problem in the muscles of the heart. Here is a list of risk factors. Increasing age, drugs, excess alcohol or binge drinking, and smoking are some of the risk factors for this condition. Now you must be wondering, is it a serious condition or are there any risks involved? The answer is yes. The main danger is the risk of small blood clots forming in the atria from abnormal blood flow. The clots can travel through the circulation and block a smaller artery. This is called embolism. The main concern is an embolus to the brain, causing a stroke. This risk is higher in older people. A common complication is heart failure, which usually causes shortness of breath. It's important to realize that atrial fibrillation can come and go with periods of normal heart function between attacks. Now, what should be done? It's important to consult your doctor if you suspect atrial fibrillation. Now, what will your doctor do? The doctor will run some tests to confirm the diagnosis and find out the underlying cause of this condition. They may order an ECG of the heart. This will help to check the electrical conduction of the heart. Then thyroid function test, blood cholesterol level, and the doctor will refer you to the cardiologist who is skilled in managing this common condition. Now, the cardiologist may run some further tests to check on you. Echocardiogram to check the structure of the heart, stress test, and angiography. What's the treatment for this condition? The main thing will be to find out underlying cause and treat it. The other issue is to control the heart rate and rhythm. Well, this can be done through some medication, or if a decision is made to stop atrial fibrillation, it's done by the process called cardioversion, which can be performed either through special medication or by an electrical direct current shock under a light anesthetic. And the next issue would be to prevent blood clot, to avoid stroke. And it depends on the cause of the atrial fibrillation and the age of the patient. So, use of a blood thinning agent such as warfarin or aspirin can be considered by the doctors. Now, how to prevent this condition? It's easy and simple. By making some lifestyle modifications, you can actually prevent this condition. Avoid smoking, drinking alcohol in moderation, follow an optimal healthy diet, and exercise regularly. Avoid any social or illicit drugs, and avoid the over-the-counter decongestants. Have your blood pressure checked regularly and minimize any stresses. Now, here are some red flags, which means you need to seek urgent medical attention if you notice any of these: a change in heart rate, rhythm, or strength, shortness of breath, swollen feet, chest pain, pain in the calf on walking, unusual symptoms such as unexplained weakness, and weight loss. That's all for today. I hope this information about atrial fibrillation was useful in understanding everything about this topic. Thank you for listening. If you wish to hear something about, leave it in the comment box below. Bye for now.